You're listening to the Beauty Beyond Bella podcast, powered by Formula Wellness.
I'm your host, Dr. Suarez, owner and medical director of Bella Excellence, a diamond-accredited anti-aging med spa in the Tampa Bay, Florida area. On this show, we explore the latest trends in health, beauty, and anti-aging medicine while celebrating the inspiring journeys and achievements of our guests. Today, we're with the infamous John Gilmore, who played 10 years with the NFL, starting with the Saints, the Bears, and our favorite Tampa Bay Buccaneers. Thank you for coming in, John.
Thanks for having me.
So I want to get right into controversy. I think when I met you, and even up to 5 years ago, we talked about testosterone replacement in men, knowing that their levels start to drop and they're lower in their upper 30s to lower 40s. And you were really kind of against testosterone, something that you were kind of inbred, I think, in the football field. Talk to me about that.
Well, testosterone is kind of a taboo thing in the NFL. Lots of drug testing, lots of performance-enhancing drugs. You got to be extra careful about what you put in your body. And I was always taught that testosterone was a no-no. And throughout my career, you heard the term steroids thrown around almost too often. I had my fair share of drug tests, random drug tests. And testosterone was never anything that I would even think, I couldn't think to take testosterone because it wasn't allowed. So, just going through that for 10 years, it just became a taboo thing.
Yeah, but now you've kind of been in the industry for aesthetics and wellness for the past 5 years. What's changed? What is your concept and your thought process now about testosterone replacement in men?
Speaking of taboo, testosterone kind of has that stigma to it for men, especially where it's always associated with performance in the bedroom, right? I don't need testosterone. Everything's good there. And, when I first started contemplating testosterone therapy, that was my take. I'm straight there. I'm good. So it wasn't something top of mind that I thought would positively impact me at the time. I believe, I was 40. I'm 40, just turned 46 last month. So I was 41 years old at the time. I didn't think I was in need of testosterone given my age. There was some ignorance there when it comes to that. But going through the diagnostic testing and pulling my labs, I was actually pretty shocked to see how low I was. And 10 years in NFL probably didn't help the situation. I learned that impact to the pituitary gland can play a negative impact on your testosterone. And that's what I believe I was seeing in the tests that were pulled. So I really opened my mind to what's really going on versus what I think's happening.
Yeah, I agree with you. I think the big stigma is about ED, right? People really think testosterone's only about ED for men and libido for women. For me, even for men, I think it's the brain fog, the memory, the fatigue. I call it the couch potato syndrome, right? You guys work really hard all day, you go really hard, and by 3 p.m., you're taking a nap on the couch because you can't function anymore. And it becomes a normal routine versus understanding that you can have all this energy all day. So talk to me about how, when you started taking testosterone, what was that like? What changes did you see immediately? What surprised you?
Well, when I first started TRT, I was doing IM injections. I was non-compliant. You had to take a weekly IM injection. The thought of using a needle to inject testosterone still didn't sit right with me coming from the NFL. Wasn't comfortable. Not a big fan of needles. I'm not afraid to admit that. But I was non-compliant in the sense that I was not keeping up with my regimen. And my wellness provider, knew that I was non-compliant and, offered, hey, maybe we should look at bioidentical hormone replacement therapy, BHRT. Really didn't know anything about it. I'm still pretty ignorant to testosterone therapy. And, once I did a little homework, this bioidentical way of treating yourself seemed like something I'd be more interested in. I'll let you talk to the bioidentical part of it and how everything, the disposition of your body and how everything just kind of jives versus the cypionate. But the BHRT was administered through pellets, which are inserted on your hip. So I went that route, and I'll tell you what, 3 weeks into it was a game changer for me. And you experienced that with me. And I remember looking at you and saying, does testosterone therapy help with joint pain? Because I remember waking up that morning, going to the gym, going through my normal routine. Midday is 2:00. I have high energy. I wasn't dragging, thinking clearly. And at the end of the day, I just couldn't really pinpoint what was different in my routine. I remember you looking at me saying, you're 3 weeks in. I said, yeah. She said, oh, you're peaking. You said, I'm peaking. You go, how do you feel? I said, the best I've ever felt in my life. And, once I experienced that, I never wanted to go back. The clarity of mind, the energy, not crashing midday, it's been a game changer.
And I love that for you. Look, I love that for me too. I think bioidentical hormone replacement, both for men and women, is a game changer. I think it gives us back what we felt like when we were 35. And it also is going to long-term decrease risk of heart disease and insulin resistance and all the things. Look, you work all the time, you eat pretty clean, but this is something that we can't help. As we age, our body decreases, and men are losing 10% every single year. So I think they get this fear that, oh, if I go on it, I'm never going to come off of it. But you're never going to make more testosterone as you get older, right? It's kind of like it's just going to wean naturally, like every other hormone does. Pellets, which are bioidentical, are also really great, particularly for men, one, that are going to be non-compliant, don't like injections. It's a little baby incision. You do peak at around 4 to 6 weeks, and then it lasts for men about 5 to 6 months. So it's a really easy thing. Out of sight, out of mind. You get one little incision, you come in twice a year, and you're great. And men will start to notice that. I think at around 5 months, 6 months, you already start saying, I think I'm running low, right? That energy starts to go down. You're not multitasking as well, as even though I tell men can't multitask, but your sharpness is not there anymore. What do you think, and what would you say to men these days that are kind of fearful of trying it and think that they're, going to be ostracized by their friends? You've become a very vocal speaker about it.
I mean, look, I think in 2025, there's a lot more education out there in social media, online. I believe the market is becoming a lot more aware of the benefits of HRT and TRT, from a male standpoint, the whole stigma of performance in the bed, you need to put that to the side. If I was given, and I have given advice to some of my colleagues and friends, former teammates, just take control of your health. Figure out what's going on inside first, right? You'd be enlightened when you start getting into the blood work of what, the diagnostic testing of what's going on. And it's a lot different than going to your primary care physician, showing up to your doctor's appointment on an annual basis. They look at your labs and say, oh, you're good to go. But what does that mean? What does good to go mean? Working with you, I've taken control of my health, and hormone replacement therapy is the biggest part of it, and again, I talked about it. I'm my best self. You mentioned now I'm working in the longevity business, overseeing operations, and that term longevity, it used to be the word anti-aging used to be kicked around all the time. Longevity has a different connotation to it in the sense that it's about living longer at your optimal self, right? And, it might, whether it's 30 years from now or 40 years from now, like my time is coming to an end and so is yours. I'm not too concerned about that, right? Whatever time I have left, whatever that number may look like, I want to feel like my best self. And to be quite honest, I still have some pains here and there, but I'm at my playing weight. I feel like I could still put in 15, 20 good ones, if called upon. And that's what this is all about for me, living my optimal self.
Yeah, look, I love that. I think that word optimal is key. I think right now we live in a society and in the medicine professional capacity, when they go see their primary, there's a range, right? And we know that range could be like where you're looking at someone from 20 to 80, and they're okay with you being on the lower range, right? But what is that optimal number that's going to prevent disease process, really help you feel great? And I know you're a big proponent. You really helped me really expand this 360 diagnostic program that we have that looks at not only your sex hormones and your liver enzyme, kidney enzymes, inflammation markers, heart markers. It really is a full look at what's going on in your system. along with, you guys love the Sika. You love to know how much muscle mass you have, how much hydration. These are things I think a great stepping stone when a man or woman comes in to start their journey to kind of get a baseline. And I know you've really enjoyed that. What part of it you think impacted you the most?
Yeah, the knowledge-based part of it, you know, learning a lot more about what's going on in my body, learning about hormones, peptides, metabolic weight loss. It's been an educational journey the past 3 or 4 years, and I've enjoyed every minute of it. The wellness space is a space that helps others. Anybody that knows me knows that you know, I have an appetite for helping people. So being in this business and a former athlete, that willingness to help people and coming from a high performance business where wellness was key, it's just kind of jived and meshed up well for me. So I enjoy it. I enjoy introducing some of my former teammates to you, to get a look at what's going on inside, take that diagnostic, that x-ray, and get on the right track. But, and you already know this to be true because you're experiencing it on the daily, that feedback that you get from the people that we're helping. That's why we keep showing up and doing this. So it's a mission of mine to get more of my former teammates educated on wellness and how they can take control of their health. And I'm doing what I'm supposed to do. So I enjoy every minute of it.
Yeah, and I agree. I think one of my best rewards is to see that accomplishment in someone, to know that you've changed your life for the positive. There is nothing more rewarding than that, whether that's you talking about your experience with them and bringing them in. But when they have that transformation, I mean, it still gives me goosebumps and makes me teary-eyed to see what an impact that can make in someone's life. And that's truly a blessing. But I want to take a step back because we've been talking about all men. But on your LinkedIn account, I see a lot of stories and proponent about menopause and perimenopause and how men should really look to support their women going through that. And I think that's really been a nice turn of events, probably because I've tortured you with my menopause and having to go through that and become healthy again. But we all appreciate when men understand what we're going through. So take me through that journey that you're talking about on your LinkedIn.
I mean, look, I've gained a lot of empathy over the years. Functioning as a woman clearly is different than being a man. And I have just a greater appreciation for that. I have 90 employees that report through me, and 2 of them are men. So I live in an industry driven by women, and rightfully so. And when you talked about going back to the hormone conversation, when you really take a step back and learn about what's going on, I'm trying to think of the saying: girls are like this, guys are like that. We went through the waffle and spaghetti.
Men are like waffles, women are like spaghetti.
Yeah, so very distinct, different creatures. And with the 3 hormones that women have internally, estrogen, progesterone, and testosterone, versus men having to deal only with testosterone, getting that mix right for women is complicated. Making sure those levels are set, making sure that there's no risk for cancer. There's a lot of different variables at play when it comes to treating women. Man, it's kind of set it and forget it, right? We can get to our optimal self pretty quickly, and get back on the right track. That's why it's a head scratcher for me to see guys really struggling and going through it when there's a solution, a healthy solution. So yes, getting educated by one of the best in the business on a daily basis has given me a greater appreciation for the wellness protocols and plans when it comes to treating a woman versus a man. So I totally appreciate it. And it's actually having that understanding, it has allowed me to do my job better. Again, working in a predominantly female driven field. So I do appreciate that knowledge, and it comes over 20 years, giving you a little shout out, 20 years in business with Bella Excellence. I believe 8 years ago, you got your fellowship through A4M, functional wellness medicine. I was there for it, right? I remember going and you sitting in front of the board. And for you to be able to treat people inside and out, given your skill sets and tenure in the business is a privilege. So I appreciate everything, all the knowledge.
Yeah, look, I think everything you're saying is so true. One, we need to have empathy. When you're a team, and I like to think that partners are teams, right? We go through this process, we go through goods and bads, and we become a team and we really support each other. And I think as relationships start to go through either andropause or menopause, we're seeing a much higher rate of divorces. People are not communicating anymore. They're not feeling their best, so they think by leaving the situation is better. I think if we take a step back and see what's going on, right? Why are we changing? I had someone tell me this morning that after I gave her testosterone, she likes her husband more, that she can tolerate him better. I think we all get moody when our hormones are off, right? So whether we're moody and crying all the time, and we start to take that out on our partner. And I think that's something, you had to go through a little bit with me. I was pretty stable with all my hormones. And when I went through my breast cancer, all my hormones were stripped away. And I remember psychologically, it was a lot for me to go backwards, right? And having to then explain, why am I more tired? Why am I forgetting? Right. And you were very supportive in that. I think that's really important for couples to show up for each other both ways.
No, absolutely. And first, and you mentioned it, it comes with an understanding, right? You know, it's tough for you to support your partner if you don't know what your partner is going through. And, getting an, a lesson in empathy and a clinical lesson, right, over the years has allowed me to, work and be a better partner to you.
The Formula Wellness 4 cornerstones are nutrition, functional wellness, aesthetics, and brain health. These serve as a guide rail for individuals that are pursuing longevity inside and out. Formula Wellness is setting the new benchmark in preventative healthcare and aesthetics. Thank you for all of your support. To learn more, please visit www.formulawellness.com.
I remember you saying to me one time, we were trying to figure out, the best way to expand wellness at Bella, and we were talking through it, and obviously our population being majority women. I was asking you some questions to figure out the marketing piece, the cost. I forget where we were going with the conversation, but I remember you saying to me, yeah, this is the answer, but John, the reality of it is less than 6% of the women in the United States get treated, for hormone replacement therapy. And when you said that, I just kind of took a step back and looked at, wow, right? There's that many women walking around feeling those frustrations, right? Feeling, going through it, the struggles. It's different than men, right? We talked about the estrogen, the progesterone, the testosterone. If it's not all intertwined and clicking, there could be a lot of things going on. So it was just amazing to me when you dropped that stat that less than 6% of the women in the United States are getting treated for their hormones was mind-boggling.
Well, you have to remember, about a decade ago, there was a study that came out, the Women Health Initiative, and it was a very poorly done study, which got blown out of proportion and started talking about that bioidentical hormones cause cancer. Now, looking back at that, it was the opposite. When you look at that study, it actually showed that progesterone actually decreased cancer, certain estrogen decreased cancer. They took all the people, and they were mostly over 60 with health concerns, and they also did all different types, including equine estrogen, so bad estrogen, horse estrogen. But if you go back now and you look at the studies in the last 3 to 5 years, it has shown that we've done a disservice. Like, we are allowing people to get ill because we're so worried about replacing them. With hormones, we had our entire life. So I always love to explain to people that bioidentical hormones is not just feeling good, right? It's not just getting our memory back, our libido back, getting our relationships back, but it's getting our health back, right? It's decreasing dementia by 40%, decreasing heart disease, decreasing osteoporosis, things that we can make an enormous impact prevention-wise. And we really took a step back. Even the FDA now is coming back out and saying, wow, we've done a problem. Like, we have now caused these black labels for men and women to get testosterone, knowing that it's a really great benefit for them. So I'm really excited over the next 5 years to see bioidentical hormones really become the main front for all of our patients without this hesitancy.
Oh, look, proactive healthcare is the new way forward. I think the mindset is finally changing. People are not sitting on their hands anymore, waiting for their primary care physician to say, hey, we have a problem here. And again, for me, it was never about living longer. It's about living my best self. And now feeling what that feels like, there's no going back. There's no going back. And now I'm starting to explore the world of peptides, the BPC 157 for my shoulders, having the joint pain. I've never dabbled in the peptides before. I've never GLP-1s. I never went there with my clinical plan. But now I'm starting to explore the world of peptides just from a healing standpoint. So, yeah, feeling like this, raising 2 kids, wanting to be able to stick around and see some grandkids one day. This is the new way forward for everybody. So the education, we talked about that, it's key.
Yeah. Look, all of our patients are saying the same thing. We want to be around. We want to live a healthy life. We want to be around not for ourselves, but for our children, for our grandchildren. Nobody wants to feel terrible as they get older, right? I don't think any of us are trying to reach 120. We're just trying to be our best selves every single day, right? Because look, tomorrow's not promised. And so the best we can do for ourselves is to take care of ourselves. And only then can you take care of everyone else. It's like being on that airplane and they say you have to put your oxygen mask on yourself first before you put it on others, right? If you do not take care of yourself, you're not there for everyone else.
Yeah, that's the oxygen mask analogy is a great one, right? Take care of number one first, or else you're not going to be able to take care of anything around you. And I've always believed in that. So, yeah, I appreciate everything that you've done to show me the way. I was a little resistant 4 years ago. I wasn't a believer 4 years ago, and I think your ability to treat people on the wellness side, your reputation as an aesthetic provider, in this market, I'm a very lucky man to have that total care solution right under my roof. So,
Well, I appreciate it. You have been very resistant. And look, I think the peptide world is probably been around for over a decade, but it's really becoming forefront in the last couple of years. I actually think there's going to be a lot more peptides coming out in the future. I think that was going to be a big way. Right now we're doing great with CJC and Ipamorelin, but I think the BPC 157 or the Wolverine pack has really impacted patients that have just gone surgery, ex-athletes, people that really have all this joint pain. I mean, it really affects multiple things. And so I'm really excited. I know we just got started, but I'm really excited to see the progression and see if we can continuously heal our body, right? In so many different facets.
well, the peptide conversation is an interesting one because when GLP-1s came on the scene, I was I was like, no way, we're not offering these at Bella. It's not going to happen. No, we don't know what's coming down the pike. And here we are 3 years later. And now there's all these health studies that show the benefits of GLP-1s from a cardiovascular standpoint, right? A diabetic standpoint, the insulin, helping to regulate insulin and all these great things that GLP-1s do for people, expanding beyond that, not even knowing GLP-1 was a peptide and understanding what peptides truly are, just, amino acids and proteins, right? I don't want to chop this up, but break it down. I know it's, basically amino acids coming together to form proteins, and you put those proteins together in different combinations and you form a peptide. Those peptides, when released in your body, they create responses in your body to do different things, right? Whether it's healing, whether it's regulating your insulin, telling your stomach, telling your body, your brain, sending signals to your brain, I'm not hungry. It's very fascinating to see what these peptides are doing. And when it comes to amino acids, we get them in our food.
Right.
So, people see all these different things hitting the market. There's the injection piece to it that may make some people step back and say, well, I don't know if that's for me. I'm not injecting myself. But when you really break it down to the science, we're talking about the amino acids that are found in food, creating these peptides. So it's a pretty cool science.
Yeah, look, that was all beautifully said. I have to say, I'm so proud. You've learned so much. And I agree, amino acid, peptides, exosomes, we hear all these words getting thrown around, and they're just natural ways that are already a part of our body that are customized for particular issues. And so why would we not do something that's very natural that would cause a healing approach, right? We would take a medication, but we wouldn't take a natural approach of healing our body from inside out. And so I really think this is the future. I think we're already in that pathway. But the more we do, I think we're going to have a healthier population.
Yeah, I don't disagree with you on that one. You can already see it, right? I feel like the people around us are starting to get healthier. Our kids have, they're aware of living a healthier lifestyle. So to your point, I think we're on the path of a better way forward when it comes to health and wellness. And that's a positive thing. So, not to make this a controversial conversation, but at the end of the day, follow the money, right? I think there's a shift in investment to the wellness industry. And historically, it was big pharma benefiting from our sickness. And when you start seeing a shift of the money and where people are investing, you'll see change.
Yeah, we're definitely investing in ourselves for sure. So if you had to give advice, especially to all the men out there, both for how to take care of themselves and how to be patient and respectful to their wives going through this, what would you say?
I would say you have to get a total care provider that looks like Dr. Suarez, and you'll be okay. A-okay. Um, no, in all seriousness, take your health serious. Be proactive in that situation, especially if you have kids, especially if you have families, you're a professional, you're out there hustling. Investing in your wellness will only pick up your game in the boardroom. I think that's a lot of people don't understand that.
I love that.
Yeah,
Yeah.
you don't have to walk around dragging all the time and said, man, I'm beat, man. I've been running all weekend at my son or daughter's tournaments, right? I got this project due, it's on my plate. I'm just beat, right? You don't have to feel like that. So taking a proactive approach to your health and wellness is only going to pick up your game wherever that is, in the boardroom, in the classroom, in the retail center, it's be your best self. So, especially, and I think you said this earlier, I think you alluded to this earlier, we have a responsibility to the one we care about, right? That special somebody in your life. You talked about being able to manage your relationships, you know, fix your hormones, fix your wellness, stop being grumpy, have more energy, maybe pick it up a little bit in the bedroom, and everybody's happier. So take control of your health.
I love that. And men, have some sympathy for your wives. It's like John said, men are relatively easy to correct. You get one hormone, we get three. And so it's a little bit harder to balance. But once we are rebalanced, we really do have a new optimal life. I mean, a new resurgence. And you will feel that. Like, I know when I'm feeling my best, you're much happier, right? Nobody wants to come home to someone that's grumpy all the time or not wanting to do anything, right? We only have one life and we really need to live our best life.
You said it. You heard it there first from the dot. Yeah, live your best life. So, I think you're going to continue to help people in this business. Bella is just now getting out in front of this wellness opportunity to help people. We have a great audience there on the aesthetic side that come in on a regular basis that are now starting to branch over into the wellness world. They're starting to see the benefits of glowing skin, all decreased thinning hair, all these benefits of hormones. So, yeah, you and the team at Bella just keep doing what you're doing. And being excellent.
We
So
try. It's definitely a passion. So I appreciate being acknowledged for that. We have one last question that we love to ask on our podcast. And that is, what does beauty mean to you?
what does beauty mean to me? I think beauty is however somebody perceives something unique, special, enticing to them. What's beautiful to me, may not be beautiful to you. But I find beauty in a lot of things. You know, I find beauty in being with my kids. I find beauty in helping people. We talked about it earlier. I love being in the woods versus the beach. We butt heads on that. I often talk about being in the woods is like being in the portrait versus being at the beach staring at the portrait. I see beauty in nature. So I think beauty is whatever hits close to home, special to you, that creates a certain emotion that you can't get anywhere else. Um, That's my long-winded answer for a spur-of-the-moment beauty question. I should have known that one was coming. I forgot that was on the list.
Well, I love if it comes from the inside and it makes it look beautiful. That's the most important part. I absolutely love that.
That was beautiful. In fact, when you talk about beauty, that was it, right?
Eureka. You've heard it here. Thank you so much, John, for coming in and being with us. I really appreciate it.
Oh, you took it easy on me.
Just a
You
little.
had me on the hot seat. I thought you were going to get a lot more into it, but you took it light. I appreciate you.
You're welcome.